Well, chances are that you've missed a dental cleaning or two since the pandemic started, but has your at-home care been good enough? Dr. Bill Dorfman is here to discuss. Doctor, thanks so much for being here.
Hey, thanks for having me, Alex.
Of course. So what are some of the biggest issues or obstacles that your patients have faced during this time?
Well, I think the biggest one is really just getting to the dentist. For a lot of people, that's hard. That's why it's so fortuitous that Oral-B has launched the new iO toothbrush. It's literally amazing. Like, I remember the first time I used it, I've used a lot of electric toothbrushes. I thought, okay, here's another one. But I use it, I'm like, wow, I feel like I have just gone to the hygienist. You get that professional, clean feeling every time you use it. And the thing that differentiates this from any other that I've ever used is normally after I get my teeth cleaned, I build up like a lot of plaque and tartar, especially behind my lower front teeth. With this brush, I don't have that. I got my teeth cleaned 2 months ago, and they have stayed just as clean as the day I got them. It's pretty amazing.
Yeah, that certainly is, especially like you said, when we haven't been able to make it to the dentist as often as we should. So why is it so important to be diligent with your home oral care? And what sort of health effects can people experience if they have poor habits?
Well, here's the thing. If you don't brush and floss properly, the first thing you'll see are bleeding gums. That's gingivitis. Gingivitis progresses to periodontitis. Periodontitis is where you actually lose bone and teeth. But more important than that, gingivitis and periodontal disease have a very strong link to heart disease. So it's not just about keeping your mouth clean and fighting tooth decay. It's also about your overall general health well-being.
Right. So what would you say are the top at-home oral care tips you can share with our viewers?
Well, the number one top tip, get the Oral-B iO. It's amazing. You know, it's not just a toothbrush either. I'll tell you something, it's really cool. When you turn it on, it times you for 2 minutes, okay? Now, most people don't know you have to brush for 2 minutes. If you see this blue light, it shows you you're not pushing hard enough. The green light shows you the perfect amount to push. And when you get this red light, it shows you that you're brushing too hard. So you use this for 2 minutes and you pair it with an app. So the app actually follows you. It's like magic. It shows you where you're brushing and the places you've missed. I mean, it's so easy. Even my 85-year-old mother can use it, and my nieces and nephews who are 9 and 10. It's pretty phenomenal.
It certainly is. Technology has made it so much easier for us to take care of our own teeth at home. So where can we go and learn more about this thing?
You can learn more about it if you go to oralb.com, but I'll tell you something that's even more phenomenal. Oral-B has made a huge commitment to help vulnerable people and people that don't have access to great dental care. They've donated $1 million in product and oral health care to people that are vulnerable. Plus, they're working with dental professionals all across the United States, and they've donated hundreds of iO toothbrushes to these people. So it's an amazing movement, not just to help America brush better, but to give the opportunity to people that literally couldn't afford it.
Dr. Bill Dorfman, thank you so much for being here today.
Thanks for the opportunity.